You're under the age of 40, you need to know this. Colorectal cancer is becoming one of the leading top diagnoses of cancer, and it's predicted by 2030 it's going to be number one. So it's important that you understand that colorectal cancer is actually happening to a lot of people. Sadly, it has happened to people who are younger than 40, some who are 30 and have gotten terminal cancer diagnosis. So I'm making this video to raise awareness about colorectal signs and symptoms, that you need to make sure that you notify your primary care doctor if you have any of those. Of course, the symptoms that I'm about to list doesn't mean that you have colorectal cancer. It just means that you need to be more aware of these symptoms to notify your doctor so that you don't miss any cancer diagnosis. Number one is if you notice any bloody stools, whether you go to the restroom and you notice blood in the actual bowl itself, or you notice when you're wiping, you notice blood in the toilet paper. That could be concern of hemorrhoids, but it could also be concern of cancer diagnosis, specifically colorectal cancer. Number two is if you have any abdominal distension, bloating, constipation. What happens with cancer is that if you have colorectal cancer, you have essentially a tumor in your colon that is blocking stool. So as a result, you could have constipation and bloating. Sometimes the tumor itself might not be so large that it's causing constipation. What could happen is stool change completely. It's a little bit more runny and it's different than what it was before. Weight loss is another one. So if you have any of those symptoms, of course, notify your primary care doctor to make sure you get a colorectal screen, such as a colonoscopy, to make sure you don't have any colorectal cancer.